Real champion. So I want to bring on our next speaker, a keynoter who's with us today, and we are very, very fortunate because Dr. Ariel Pablo Mendez was appointed by President Obama in 2011 as Assistant Administrator of USAID, the U.S. Department for Aid, for Global Health. It's a big job. It covers child mortality, maternal mortality, AIDS, a number of other big issues, and it's a big job, and he's the right man to do it. Before coming to this important job in our government, he was at WHO in knowledge management, and then as an experienced public health physician from Mexico, he most recently served as the managing director at the Rockefeller Foundation, leading their global health strategy on e-health and the transformation of health systems in Africa and Asia. I have to say, without his leadership and his vision several years ago, the mHealth Alliance might not exist. He was instrumental in pulling the entire community together at the Bellagio Conference Center that the Rockefeller Foundation runs, and out of that came the mHealth Alliance and much of the movement we're celebrating today. So please join me in welcoming Dr. Ariel Pablo Mendez.
Good morning. Thank you for this opportunity to speak to an incredible community of innovators and entrepreneurs and many others who are also, in the case of global health, serving the cause of the poor around the world. 4 years ago, we were in Bellagio with the UN Foundation and the Rockefeller Foundation and many others, and it was really the meeting where the mHealth Alliance was born as an idea. At that time, my colleague Carl Brown, who might be in the audience, put forward the idea to Wikipedia to enter mHealth into Wikipedia, and the editors rejected the term as a neologism. It was a made-up idea. What was that? And here we are, just in 4 years, an incredible mobilization around the world, coinciding, of course, with the incredible and well-documented expansion still ongoing of cell phones access around the world, particularly in our case, in the developing world. We work in over 80 countries for the last 50 years with programs in global health and other areas of development, from communities to governments. One of the key objectives or goals of USAID is seeing an end of preventable child death and maternal mortality. While we have made great strides in ending maternal and child deaths in recent decades, is quite astonishing actually. There's still much work to be done. In 2001, nearly 7 million children died before their 5th birthday. That same year, nearly 300,000 women died during pregnancy or childbirth. And there were 390,000 new HIV infections in children. Infectious, life-threatening diseases like pneumonia, diarrhea, malaria are further exacerbated by malnutrition, poor access to health and services. It's a tough job, but a wonderful job. We know that good health provides dividends for life. Children who are healthy and well-nourished avoid permanent disability and spend more time in school. They also are more productive, and their parents also are more productive. We've seen extraordinary progress over the last 50 years, as child mortality rates around the world have declined by over 70%. In just the last 2 decades, more than 50 million children's lives have been saved. People are now living over 20 years longer than we used to. Also in the developing countries, the gains in what we call the global south are actually faster, and the gaps between rich and poor are narrowing. This past June, at the Child Survival Call to Action in Washington, world leaders embraced the strategic shifts necessary to further speed up progress in reducing preventable maternal, neonatal, and child deaths. These shifts include increasing efforts in countries where most deaths occur. 5 countries account for 50% of all child deaths in the world. It almost feels like polio, 3 or 4 countries where the big action needs to take place. We are also focusing on the most vulnerable populations, clearly the poor, that your dollars will give you the best bang for the buck. At the same time, it's harder, but actually efforts have shown that gains do not slow down as you go into the last mile. And investing in high-impact solutions and innovation to address the bigger killers of kids, including now quite prominently neonatal complications that account for 40%, 50% in the case of Asia, of all child deaths. These high-impact solutions are evidence-based, life-saving interventions that many of you already are familiar with, from expanding contraception choice to preventing and treating maternal complications, immunizations, preventing the transmission of mother to child of HIV, treating newborn sepsis, all of that. But while we have a good understanding of what and with what to address these problems, there is still a lot of room to improve on the how to get them to mothers and children who need them at scale, in a sustainable fashion, at the precise moment that they need them, with high quality and affordable cost, what we call the science of implementation, adapting, scaling, sustaining solutions. That's where we believe that the potential for mobile health in the developing world, in the global south, is greatest, serving as a tool to help us ensure that everyone has access to appropriate health services at an affordable cost. This is the very definition of universal health coverage, and we believe that we're going to see an expansion in health coverage around the world. There are several ways in which mHealth can help us in addressing the challenges in global health in the global south and leapfrog health systems to do better. Addressing the needs of patients, providers, health information systems, payment systems. As we do in this country, we also need appropriate systems to do so in the global south. First, mHealth can empower patients and caregivers with the information that they need to improve their own health and that of their families, and to seek appropriate care when illness strikes. For example, MAMA, the Mobile Alliance for Maternal Action, is a public-private partnership between USAID, Johnson & Johnson, with the United Nations Foundation, the mHealth Alliance, and Baby Center, and many other supporting partners. This partnership aims to inform and empower low-income, expectant women who are at risk of complications and death during pregnancy and childbirth, as well as new mothers caring for their infants through text messages and interactive voice response. The traction of these interventions is fantastic. I've seen it on the ground in Bangladesh. This October, MAMA won the Fast Company Innovation by Design Award in the service design category, highlighting the possibilities for mHealth to do good in the South while also being quite competitive globally. CycleTel is a unique mHealth service developed by Georgetown University's Institute for Reproductive Health with funding from USAID that offers a family planning method directly to users of mobile phone via text messages. CycleTel is based on the standard days methods, a fertility awareness method that helps women know which days during her menstrual period is the most likely to become pregnant. Such standard days method has been proven to be more than 95% effective when used, and cell phones help us do that in preventing pregnancy when used correctly for those who do not want to get pregnant. Second, mHealth can help healthcare providers provide high-quality services by improving their use of evidence-based practices. Grameen Foundation last year received a Saving Lives at Birth Grand Challenge grant co-founded by USAID, the Norwegian Ministry of Foreign Affairs, the Bill and Melinda Gates Foundation, Grand Challenges Canada, and the UK Department for International Development to scale up their community health worker platform in Ghana. And this year, DIMAGI received a USAID Development Innovation Ventures grant to scale up their community health workers platforms in India. Both of these mHealth solutions give community health workers the tools they need to manage their patients more effectively, equip them with evidence-based decision support tools, and counsel their patients on health promotion and treatment compliance. And of course, the Empowering Frontline Health Workers Alliance is now an innovative public-private partnership designed to improve child health by accelerating the use of mobile technology by millions of health workers around the world. The partnership was announced at the Child Survival Call to Action that I referred to, with 10 founding members: USAID, UNICEF, the Frontline Health Workers Coalition, Qualcomm, Vodafone, Intel, the MDG Health Alliance, Glaxo, Precate Foundation, and the Absolute Return for Kids. So there are many people willing to help. Third, mHealth can also help us strengthen health information systems. That's sort of the origin of information technology, although we believe cell phones and mobile health is more than just information. It is really changing behaviors, changing the way in which health systems operate. The Open MRS is an open source electronic health record solution that links together various sources of patient data and enables providers and managers to improve the quality of clinical care. There's also IRIS, an open source human resource information solution that gives managers the ability to improve the effectiveness and efficiency with which they recruit, train, deploy and retain healthcare workers. And last, mobile money, which we believe can replace cash in a growing number of countries and help increase the speed and efficiency with which health-related payments are made. For example, mobile money can be used to pay health insurance premiums, make health providers payments, pay salaries, replace paper-based vouchers, and process conditional cash transfers more efficiently. You can imagine in developing countries that efficiencies of more than 20–30% and a lot of the corruption that sometimes happens in moving money is also addressed. The Better Than Cash Alliance was recently founded by USAID, the Bill and Melinda Gates Foundation, Citi, the Ford Foundation, OMIDR Network, UNCDF, and the Visa Group to explore these opportunities over the next several years. I believe all of these pieces are great, but bringing them together where needed and integration is what we are after. I can imagine a platform, an integrated suite of applications for a woman in a poor country that help us space or delay the pregnancies, that help us have a healthy pregnancy, that help her address a healthy baby, that you can use to encourage with vouchers for services and so on. That integration is what the field of e-health and mHealth is about. To conclude, mHealth is without a doubt a promising new tool in our global health toolkit. But we are only as good as we make it happen in countries on the ground. And we are just now starting to understand how we can further speed up progress in reducing preventable reproductive, maternal, newborn and child health deaths. USAID is committed to working with all of you to find and deploy sustainable solutions at scale for these challenges. Thank you and enjoy the final day of your summit. Thank you very much.